Before entering the room, I'm going to check for scene safety. I can see that there are no wires or spillages that may cause any slips or trips. The scene is safe, so I'm ready to enter the room. I'm going to close the door and draw the curtains to provide privacy to my patient. Before doing so, I'm going to do hand hygiene according to WHO standards. I'm going to apply gel on my hands and I'm going to rub it palm to palm. Back of the hands, fingers interlaced, fingers interlocked, thumbs in rotational motion, fingertips, and allow to dry for 20 to 30 seconds. I'm ready to approach my patient. So, hello, good morning. My name is Aya. I'm going to be your nurse for this morning, and I'm here to do an nasopharyngeal suctioning because the doctor has mentioned that you are not able to expectorate them. Before doing so, I'm going to check if I'm indeed with the correct patient. Would you be able to let me know your name and date of birth as I counter check it with my document and your wristband?
Yes, Lindsay Lujan, 1/1/1988.
Perfect. I can see that your MRN number is 1234567X. I can confirm that I'm with the correct patient. Lindsay, I also do not note that you have a red wristband. I just want to confirm, are you allergic to any food, drug, medication, or latex that I should be aware of?
No, I don't have any.
Thank you. That's correct. I can see it clearly from my documentation as well. So I can confirm that I'm with the correct patient. So like I mentioned earlier, I'm here to do your nasopharyngeal suctioning. I would like to gain your consent for it. Would you allow me your consent?
Yes, you have my consent.
Thank you so much. So I'm going to explain the procedure to you. So it's not going to be a painful procedure, but it is a little bit uncomfortable. So during the procedure and prior to that, we'll have to establish a few set of instructions for you so that you will be comfortable as possible. Is that okay?
That's fine.
Perfect. So first of all, we'll need to arrange a hand signal because during the procedure, you won't be able to speak. But I will determine that later, or we will determine that later once we establish your nostril patency, okay? I want to also reassure you, Lindsay, that I will be monitoring your condition all throughout the procedure. I will note your color, your breathing pattern, your respiratory rate, your heart rate, secretions, as well as evidence of trauma and distress. And I will use pre-suction observations as baseline guidelines for you. Is that okay?
That's fine.
Perfect. Finally, I would like to assist you in a semi-upright position.
I can do it myself.
Perfect. It's important for us to be in a semi-upright positions. I can also put a pillow behind your head if you want me to do that, okay?
Okay.
Say I want to do a final check with you. I just want to check your nostril patency, if that's okay.
That's fine.
Are you able to sniff through one nostril by covering it with one finger?
Okay, sniff.
Okay, perfect. How about the other?
Sniff.
Perfect. So I can confirm that your nostrils are patent. Which nostril do you prefer for us to use?
Probably on my right nostril.
Right. So perfect. So we'll use your right nostril. With that having been said, I want us our hand signal to be you raising your left hand. Can you do that for me?
Yes, I can.
Thank you so much, Lindsay. So I'm going to go and prepare all of the equipment that I will need for the procedure. Meantime, if you need a hand, you can use the call bell that's right beside you. Somebody will be there to attend, okay? So now that I've left my patient's bedside, I'm going to first do hand hygiene again according to WHO standards, rubbing palm to palm, back of the hands, fingers interlaced, fingers interlocked, thumbs in rotational motion, fingertips, and allow to dry for 20 to 30 seconds. Before preparing all of my equipment, I will need to put my PPE on, starting with my apron. Putting on my mask. And my goggles. And I will prepare all the equipment that I need for my procedure. I will need to get a disposable tray, which is clean, dry, and intact, so I'm happy to use that. I will also require a nasopharyngeal suction catheter, which is in a clean, dry, intact packaging, no discoloration, expires 2028 May. This is appropriate to my patient's size because it's French 12, so I'm happy to use this. I will also need a suction tubing rather. Expiry date 10/2025 in clean, dry, intact packaging, no discoloration, so I'm happy to use that. I will need a pack of sterile gauze for wiping my patient's face clean. Clean, dry, intact, no discoloration, expires 2028 January. So I'm happy to use that as well. And I will need a galley pot that I will fill with sterile water for the procedure later on. So now that I've got all of the equipment that I need, I'm going to bring this all and head to my patient. Right, so I'm going back to my patient again. Hello, good morning, Lindsay. I'm back. I've got all of my equipment here with me. So before we begin with the procedure proper, I just want to reassure you that I've already drawn the curtains and closed the door for your privacy. And I've ensured that there's a working oxygen on standby as if when we need it. Is that okay? Perfect. I just want to make sure that I have a working suction machine. So what I'm going to do is I'm going to turn on the suction full. Okay, I can see that it's working there. I'm going to check. Definitely working. So what I'm going to do is I'm going to turn it to 100 to 150 millimeter mercury or between 12 to 20 kilopascal. Okay, is that fine? Right, so now that I've turned it between 100 to 150 millimeter mercury, I'm going to now attach my suction tubing. Prior to that, I'm just going to open this a little bit so it's ready for me to give to you later for wiping your face clean. Okay, that's my gully pop with sterile water. And I'm now going to proceed to connect the suction tubing to the suction machine, maintaining ANTT and ensuring that there are no coils or kinks in the tubing. Right? Are you okay, Lindsay? Please don't be nervous. Like I said, I'm going to monitor you all throughout the procedure, and I will ensure that the working oxygen is right there. All right. So I'm connecting it using ANTT. I'm disposing of that. Right. So now that I've connected it, Lindsay, I'm going to first lubricate this. Lubricating into the sterile water. And I'm going to insert this into your nostril as you inhale, okay? Right? As soon as I feel resistance or uncontrolled coughing, I'm going to withdraw it for 1 centimeter first before applying suction, alright? Right. So inhale for me, Lindsay. Right, Lindsay? So I can feel resistance already. So what I'm going to do is I'm going to withdraw it for 1 centimeter. And then I'm going to apply continuous suction, slowly withdrawing it for no longer than 10 seconds. Perfect. So I'm lubricating it and flushing it as well. Would you like me to do it again? Because I can do it a maximum of 2 times. Perfect. So I've lubricated and I've flushed that already. So again, Lindsay, inhale for me. Perfect. I can feel a little bit of resistance now. I'm pulling it back again, 1 centimeter, and then I'm going to apply continuous suction for no longer than 10 seconds, slowly withdrawing it. How does that feel, Lindsay? Perfect. Right? I've flushed that already. So what I'm gonna do is I'm gonna turn this off. I'm gonna leave you this package of gauze which I already pre-opened just to ensure that your face is clean. And while you're doing that, I'm going to dispose of all of the equipment that I use. Is that okay? Perfect. Right? So I'm gonna remove this, put it in the clinical waste bin. So I'm gonna get the rest of my equipment and I'm gonna dispose of this here at the bedside. So the packaging for my catheter suction tubing is gonna be in the general waste bin. The galley pot and the tray will be in the clinical waste bin. What I'm gonna do is I'm going to first remove my PPE, removing my gloves, doing hand hygiene according to WHO standards. Palm to palm, allow to dry for 20 to 30 seconds. Next, I'm going to remove my goggles. Going to bend a little bit forward. I'm going to grab the elastic and I'm going to take care not to touch my face. If it's disposable, I'm going to dispose of it in the clinical waste bin. If it's reusable, I need to clean it with a Clinell wipe. And finally, I'm going to remove my face mask. I'm going to use the elastic part that's behind my ear forward, bin it into the clinical waste bin, and again, apply hand hygiene according to WHO standards. So, Lindsay, are you comfortable?
Yes, thank you.
Perfect. So now that I am done cleaning my hands, you can alert us if you need any help. You can please use the call bell that's beside you, okay?
Okay.
Perfect. It was nice to meet you. Thank you for your cooperation. And now, Mrs. Susser, I'm going to end my station using hand hygiene.